This episode is brought to you by Companion. Iris and Josh seem like the perfect match, but when a weekend getaway turns into a nightmare, Iris realizes that things aren't as perfect as they appear. From the creators of Barbarian and the studio that brought you The Notebook comes a twisted tale of modern romance and the sweet satisfaction of revenge. Companion, only in theaters January 31st. Rated R, under 17, not admitted without parent.
Did you know there's a hidden process in your body right now that could be determining how quickly or slowly you age? Welcome to Age Better. I'm Barbara Hannah Grufferman, your host, and today we're exploring a fascinating force that might be the key to understanding and slowing how we age, a process scientists call inflammaging. From COVID-19's lasting effects to those mysterious zombie cells you may have heard about, one factor keeps emerging in the science of aging: inflammation. But this isn't just about the kind of inflammation you feel when you twist your ankle. We're talking about a subtle, persistent, drip, drip, drip process that could be silently affecting everything from your heart to your brain. To guide us through this complex territory, I'm thrilled to welcome Dr. Chiara Giannarelli from NYU Langone Health, whose groundbreaking research is reshaping our understanding of inflammation and heart disease. Dr. Giannarelli isn't just studying inflammation, she's uncovering its secrets at the deep cellular level, revealing how this process might be a hidden driver of aging itself. So today, we're diving deep into questions that could change how you think about aging, like, does inflammation really spike after 50? What simple blood tests might reveal your inflammatory status? Are there medications that are available right now to help? And most importantly, what practical steps can you take right now today to control inflammation and protect your health long term? So get ready for an eye-opening discussion that goes way beyond the headlines to give you actionable insights into aging better. Whether you're concerned about your heart health, interested in the latest anti-aging breakthroughs, or simply want to understand what's happening in your body as you get older, this episode is your roadmap to taking control. You can learn a lot more about Dr. Chiara Giannarelli's groundbreaking research in the show notes, so please do take a look after you listen to this episode. Okay, everyone, get ready to age better.
Thank you. It's my pleasure to be here.
We're talking about a very important topic, and I'm really looking forward to this conversation. So let's start with the basics. What exactly is inflammation, and how does it impact us even more as we get older?
Okay, this is a very important question, and I'm glad you asked, because there is something that needs to be explained about inflammation that I feel is very important. Inflammation is neither good or bad per se. Inflammation is a vital defense mechanism that our body has. It's a natural response to an injury, an infection. It helps the body heal. So it's a normal part of a body response. And it occurs when, there are chemicals that are released, sensing cell damage. And this triggers a response of our immune system to fight off infections or heal a damaged tissue. So once the infection is defeated and injury is healed, the inflammation process ends. This is a very important concept because this is where the concept between normal inflammation or physiological inflammation ends and where pathological inflammation starts. So let's rephrase this assumption that inflammation is synonymous with disease, with pathology, but rather is a response that needs to be appropriate and needs to quench, needs to stop when it's no longer needed. So the concept of inflammation conceived as a response that is prolonged over time, that's where disease starts. So
Okay.
we are at the point where instead of stopping because there is no longer need to have an inflammatory response, the body keeps acting, keeps sending these inflammatory messages, immune cells are activated, and this leads to a chronic state of inflammatory conditions that is what brings disease. So
Got
it's
it.
an abnormal immune response.
Okay. And can you explain the concept of inflammaging, which is a very kind of hot word being used now to describe what happens to the body as we're getting older when inflammation is chronic? What is
Yes.
that, inflammaging?
So this is a term that is used in the field to describe the phenomenon of increased chronic inflammatory state as we age. So the concept is relies on the fact that during aging, we have a disequilibrium progressively between the body producing accumulation of cell damage and resilience mechanism that helps repair that damage that eventually causes the disease. And on the other hand, the immune response system that is the way our body also responds to this accumulation of, let's call it bad cells or cells that are damaged. And aging is associated to this persistent activation of the immune system that senses these accumulating cells, damaged cells. And this leads to the production of inflammatory molecules that are released and gives rise to this concept of inflammaging.
Of inflammaging. Yeah, it's a very hot term right now. And is it true that inflammation and inflammaging really starts to kick in and increase, accelerate after 50, after 60? And if so, why? Why is that happening? Why is that happening just because we're getting older?
Well, this is also another important point because there is evidence from studies and observational studies. For example, the National Institute of Aging supports many prospective cohort studies to get around this problem of inflammaging and aging and increased inflammation, trying to really understand where it starts. And yes, it's true, there is this number that's been proposed as aging beginning at the age of 50. This might not be exactly true in the sense that there are other models in science and what we are trying to study that actually propose a progressive model of inflammation rather than something that all of a sudden happens. There is this belief that there are, before the age of 50, some pathophysiological mechanism related to inflammaging that starts and then become more important in terms of linking with disease after the age of 50. There is also another consideration to make is the majority of the studies that we have available enroll patients that are, or individuals that are over the age of 50. So there might be a little bit of knowledge gap in what happens before the age of 50. So we need to do more studies
about that. Yeah, that's interesting. So what you're saying really is that some magical switch is not turned on when you hit 50, that a lot of this chronic inflammation could be happening before you're 50 and it's just continuing on. It sounds like, and perhaps getting a bit worse, possibly.
And Barbara, keep in mind that there are several factors that can influence the trajectory of aging and inflammaging in different people in different ways. So if you have an underlying conditions or, for example, diabetes or other chronic inflammatory disease, you might be on a steeper aging trajectory that can be modified by treating the underlying condition. So it's a very complex matter. And that's why I acknowledge the studies that report this magic number 50, but I believe that there is more than we need to learn.
More research.
And perhaps we will have the opportunity to prevent inflammaging or slow down,
possibly, hopefully even reverse. So let's talk about the specific diseases and health issues and challenges that can happen as a result of this chronic drip of inflammation and the increase of chronic inflammation. And can you explain how the more inflammation in the body, the greater the risk for very common issues like cardiovascular disease, cancer, diabetes, you mentioned that already, and even dementia?
So you're correct that chronic inflammation, chronic low-grade inflammation, I really would like to stress this point because we are talking about an inflammation that is much lower in terms of potency compared to what we experience during an infection. So it's a chronic sterile inflammation that has been linked to several diseases, including cancer, type 2 diabetes, cardiovascular disease. I'm referring to heart attack and stroke, but also Alzheimer's disease. Other conditions that are linked to inflammation are rheumatic disorders, right? Rheumatic arthritis, for example, or inflammatory bowel disease. So a lot of disease have as a common denominator chronic inflammation. So definitely inflammation is very important in all these conditions. And this can create essentially a continuous progressive status that prolongs the inflammation, boosts and aggravates each one of these diseases. For example, if we take them one by one, for example, I named cancer. And cancer is, it could be related to different ways to inflammaging. And for example, when you have a chronic inflammation, you can have damage of the DNA, you can have an immune system that is less efficient, less specific at recognizing and being able to destroy cancer cells. So the relationship is very complex. In type 2 diabetes, for example, often diabetes is associated with excess body weight. And these, the fat can release inflammatory cytokines that can aggravate diabetes because they can contribute to aggravating insulin resistance. In the context of heart disease, this is what I study in particular, chronic inflammation can be damaging the lining of the blood vessels, and this can promote plaque buildup, and plaque buildup can lead to increased risk of heart attack.
Right.
So the last disease I mentioned is Alzheimer's. And also in this context, chronic inflammation is recognized to be contributing to Alzheimer's disease by damaging brain cells and contributing to disrupting cognitive function as we age. So inflammation is definitely important across different diseases.
You didn't mention osteoarthritis. Is that something that you see connected to chronic inflammation as well?
It is primarily an inflammatory disease.
Also so common. I myself have it in my knees.
And also very common. And what's, I think, a good example about the importance of inflammation in all these conditions is the association of rheumatic disorders with increased risk for cardiovascular disease and heart attack, for example, because it is recognized that in this chronic inflammation that is associated with autoimmune diseases like RA, rheumatic arthritis can aggravate the risk for a heart attack. So it really gives the sense that inflammation is at the basis, or at least contributes to disease progression across diseases,
Yes,
for example.
it's really, and you've used the word complicated a few times already in our discussion, and it really is. All of these connections are really quite complicated, and clearly more research needs to be done. But I know your own research focuses on atherosclerosis, and so can you share some of your key findings about the role of inflammation and how it can, accelerate the clogging of, adding more plaque and creating clogged arteries?
So I will share, Barbara, that my research focuses on cardiovascular human immunology. So we really study human disease. We study blood samples. We study tissue samples that we obtain from extra tissues that's been removed during surgical procedures. So we really make the best use of this tissue that will be otherwise discarded.
Mm-hmm.
And we have learned that the immune system is really a big factor in progressing atherosclerosis. Let's take a step back. Atherosclerosis is the condition that causes plaque buildup.
Yes.
It narrows the arteries, it reduces blood flow that goes to your brain, to your heart. So it's really a fundamental disease that needs to be cured, because by doing that, you are able to reduce the risk for heart attack and stroke. So it's really important. And we have learned that the immune cells, when we analyze these tissues, are really extremely represented. There are a lot of immune cells in these lesions that we analyzed. And in particular, we found that other than cells that are very important, like macrophages, that are cells that try to get rid of the lipids that is being accumulated in these plaques, there are other cells that are probably a sign of a more chronic inflammatory conditions that are called T cells, that are the majority of the immune cells in these human plaques. And we don't have many tools as of now to treat directly inflammation in human disease. There are a couple of trials that have led to the approval of a drug that's called colchicine in some patients that have particularly high risk and they have heart conditions. And it's really beneficial because it reduces inflammation and reduces the risk of heart attack in patients who need it. And not everybody has indication for colchicine. So we know that this is a way that works in preventive care, but we need to do more research to have more tools, more drugs, and more tailored treatments for different type of patients to prevent heart attack.
I have a question about colchicine, because cardiovascular disease remains the number one disease and killer of women. I really focus on it a great deal. I look for studies on a regular basis. And in fact, a year ago or so, I saw a study about colchicine and how it was going to be FDA approved for that purpose, exactly as you just described. But then I looked for follow-up studies, and I did see some studies recently, only in maybe the last 3 months, that showed that it wasn't really showing the benefits that they were hoping for. Now, you know better than I how studies can be flawed. They may not be exactly what we hope them to be with regards to how many people were involved and all the details of it and so on and so forth. So it sounds to me as though you still are a proponent of colchicine as a way to decrease inflammation in the body as it relates to heart disease. Am I right?
Well, I was referring to the fact that based on these studies, the FDA has approved the use of colchicine, and colchicine might not be the perfect drug, but it is what we have as of now, and it works in some patients. I think that the concept of precision medicine is something that is going to be very important in the future. And large clinical trials are essential. That's how we know that drugs are effective. But they might not capture fully the fact that the drugs may work better in certain patients than in others. So we have to pursue in the future also different approaches that might help us understand why we have these discrepancies. And I think you are right in terms of women. There is not enough research trying to understand why women experience cardiovascular disease and what are the differences in between women and men. There are extremely important disparities in cardiovascular health and recognition of cardiovascular disease in women. Women are underrepresented in clinical trials. Women are often dismissed because they have symptoms that are not as clear as in men. So we need to have awareness about the problem and we need to take action. So I think that we will need to design studies that specifically help us address these gaps, because there is this misconception that women die less of heart attack. Women are equally, if not more, affected by heart disease, and they're not treated. And actually, they tend to have worse outcomes as they age.
Yes.
So we need to do more research understanding how this happens, and perhaps it will make sense to, based on these studies, consider that we might need to treat women differently, and women immune system is different. We know this. Women are more susceptible to autoimmune disease, for example, than men. And the immune system is extremely important in cardiovascular disease and other conditions. So we have to take a step into making more effort in science.
Absolutely. And also we have to, as you know, take into consideration what happens to women's bodies as they travel through menopause. We now know, which we didn't know just even a few years ago, the impact that hot flashes, more than just an inconvenience, the impact of hot flashes on the heart.
Yes.
And so this is all now emerging. And again, you're so right. More research needs to be done. I think that is starting to happen. There has been an uptick thanks to the soon to be prior government. There has been an uptick and more money has been put into women's research. So I'm very hopeful, but oh my gosh, we have such a long way to go. Before we leave and I move on to my next question, I really want to get back to colchicine for 1 minute because I'm personally very intrigued by it. And I'm following it, as I said, very, very closely. And so for everyone listening in, is this something that should be discussed with their PCP, the primary care physician, or a cardiologist, if my listener has a cardiologist, to discuss, hey, maybe I am a candidate for colchicine? One other thing, too, I want to throw in there. I regularly nag with love in my heart, as I like to say, for women to really everyone to get the calcium score tests to see, well, what is the state of their arteries? Do you even know? Of course not. It's unless you have severe blockage and then you have symptoms. But I did the calcium score test and it was 18, which shocked me being a runner and a healthy eater. So I do encourage, but just if you could give a quick tip about the colchicine discussion.
Well, I will say in general that we women needs to have better care of ourselves and go see our primary care doctor. If there is a particular concern about heart risk, I will just book an appointment, see a cardiologist, and any of these questions should be referred to your own cardiologist because, as I said, colchicine is not.
And precision medicine also, you
Yes,
mentioned.
and it's very important, and it's not everybody has the same cardiovascular risk. There are tools that help assess that. Calcium score, if indicated, is one of them. But I don't feel comfortable giving an advice for everybody, but for sure,
Have a discussion.
have a discussion. Colchicine is not for everyone.
Right.
So the cardiologist is the best person that will tell you whether you are a candidate for that treatment or not.
Perfect. Thank you for that. Let's get on to COVID-19. I mean, it's, I wouldn't say it's still a hot issue, but people are concerned about the long-term impacts of COVID-19. I know I am. I've had it. I had it a year ago. I went almost 4 years without getting it and then finally did get it. I was shocked. But anyway, of course I think about, well, what did that do to my body? And I think everybody does. So based on your own research, what do you know so far about the coronavirus and how it can trigger inflammation and potential changes to our body, especially when we're looking at our cardiovascular risks?
Well, you mentioned that this is not a hot topic anymore.
Although it should be.
I think it's still very important.
Mm-hmm. Me too.
Because we are dealing with the aftermath of a pandemic.
Exactly.
And my lab is really intensively working on this topic because there are a lot of people that are still suffering from post-COVID conditions, and we are really interested in understanding why there is an overall increased risk for cardiovascular events 3 years after the pandemic. And there is a lot of effort worldwide in really focusing on assembling different scientists that have different expertise in looking into these very debilitating conditions that are referred to as PASC, post-acute COVID sequela. And I will say that we really need to focus on this problem to help people that still experience debilitating symptoms, but also may have long-term cardiovascular effects, which we don't know. We will know, but we can't wait for the epidemiological studies to tell us that we need to act proactively and trying to understand how having had an infection influence your cardiovascular risk in the future. So we are trying to figure out these as much as we can using our resources. And we are not focusing on necessarily severe cases. We are including also mild cases. Yes.
And how do you define mild case even for someone who might have still felt sick, but who was not hospitalized?
Yes. Yes.
That's how I would
that.
view my own case.
Exactly. And there appears not to be necessarily a linear relationship between the severity of post-COVID and the severity of acute COVID symptoms. So it's really important to be aware of that. And we have no tools at this point, but we can be wise for ourselves and try to prevent exposure. And there are vaccines that everyone can consider continue getting as we move into a post-COVID phase. So there are options that we can choose to take to reduce our risk. And for example, there are studies that shows that vaccines reduce risk for cardiovascular events and other symptoms. And if you are able to prevent a second infection that appears to be good in terms of subsequent risk. So we are learning a lot about this problem, and we hope that there will be a solution for people soon.
Yeah, and thank you for all the work that you and your team are doing on our behalf. So what are some of the most important blood markers, blood tests that one can get? For example, I had a cardiologist on that recently, and, we went through a whole slew of things that people really don't think about. And I myself ended up getting them. And I was very pleased with the result. Like it was CRP, the one specific for cardiovascular risk, then the regular CRP, the LPA, the ApoB test.
Yes.
For example, these are all things that I got because I was fascinated by these blood tests that you can get very simply and inexpensively if your insurance doesn't cover it. But specific to our conversation today, what are some of those that you think that women and men, everyone should be getting once they're in midlife?
So there are several tests that are established that can detect inflammation, that are used as routine medical care. And you mentioned one, CRP is a C-reactive protein, and this protein is increased when you have an inflammation. There are others that are called ESR, or erythrocyte sedimentation rate. Ferritin or fibrinogen are other tests that are really inexpensive, are used routinely. There is no indication to get tested on a regular basis for these inflammatory markers unless there is a reason. And the reason is because they can't really distinguish between the type of inflammation. So they detect that there is an inflammatory status, but it could be because you have a cold, maybe you have an injury and your body is repairing something. But it could also be because you have underlying conditions like diabetes, obesity, cardiovascular disease. So they are important. But again, getting this type of test is part of a conversation that you need to have with your doctor, because they will be able to advise on the proper time, on whether you need this test or not. And I will say that these tests are important, but also other tests that are more common, like having a lipid profile checked regularly, or testing for glucose, or any other checking your blood pressure is extremely important, because those are actionable items. If you have high lipid, you can do something about it. You can take a pill, you can take a statin or another drug that your provider will prescribe based on your situation. And this is something that you can do as part of your overall body to preserve your health. And as a consequence, these factors may also help in managing inflammation as well, right? I think that it's important to be aware of inflammation. We don't have tests that are immediately actionable in terms of defining what type of inflammation you have and what that means for you in terms of long-term disease or risk for different type of disease.
Cardiovascular disease. So let's talk about lifestyle now, because you mentioned there are some things, of course, that we can really fix somewhat. Some things are genetic. So let's talk about lifestyle changes. What can we do to really impact our inflammation levels? Let's just say that we have been tested and there is inflammation and there are even symptoms of inflammation. What can we really do to either prevent it from increasing or certainly to reverse it?
Yes. So this is extremely important. This is where the core of preventive medicine should be. And we should act on these items before we get to prescribing medications. And often you need to implement both, right? You need to improve your lifestyle as well, taking medications. But I believe that changing lifestyles is fundamental, it's important, is extremely hard to do. And often we fail. But I think that is becoming more and more important.
And I think it's understood.
It is understood,
Yeah.
and this type of support is also getting more and more embedded into clinical practices. For example, several preventive groups have nutritionists, or they help with mindfulness strategies that can help with dealing with stress,
management,
helping with sleep and stress management. And of course, also exercise is extremely important. All these elements, diet, exercise, stress,
and sleep,
and having a good sleep, are very important for the overall health. And they also have link with inflammation.
Yes.
And we know this from studies, experimental studies that investigators are conducting. So overall, I will say that probably because I'm from Italy originally, but the Mediterranean diet
Yes.
is a good example of a good, a balanced diet where you have fresh ingredients and simple ingredients that includes vegetable, fruits, and legumes and fish. So all of these are good examples of what a healthy diet should be.
Yes.
And I think that the importance of freshness, fresh ingredients is really key, non-processed, because that helps you also control what you eat, right? You know what you're putting in the food you eat. And
it helps you control the amount of sugar and salt specifically too.
And it doesn't have to be complicated.
No.
Sometimes there is this understanding that home cooking has to be complicated. It could be just a mix of a healthy salad where you know what you're putting in.
Exactly
with
right.
Some protein in.
Very simple. I mean, that's how I cook and prepare my meals. And I really do keep it simple because we're all busy, but we want to eat well. So I do keep it simple. And
exactly.
I see so many studies recent years. I mean, and it's really even more important now and being focused on even more is how moving and really getting your heart rate up for specific periods of time is like medicine. It really can help with a lot of these issues. And the good news too is I always like to tell everyone when they go, oh my gosh, now I have to start doing this for inflammation. Well, no, not just for inflammation. All of this is going to help everything.
Yes.
From head to toe, inside and out. Just kind of view it as this overall plan for your overall health and well-being. I also wanted to just very quickly, if you could talk through the connection between inflammation and telomeres. I get fascinated by things and then I get like really overly focused on them, but telomeres is really very fascinating to me. And I remember reading that book, and I can't remember the author's name, the researcher and professor, and she won I believe, the Nobel Prize for medicine at that time when it came out, focusing on telomeres, the protective caps of our DNA. So what is the connection between protecting those telomeres and inflammation? I mean, it just seems to me logical.
So telomeres are structures. You described them very well. They're kind of cap. They're at the very end of the chromosomes. Chromosomes, we are all familiar with their shape, right? X and Y. And it's a long piece of DNA that is wrapped up on itself. It looks like a Y or X structure. And this long DNA has two ends, and they're just hanging out loose. And if they're not protected, something can go wrong because they could be cut off. They could join into other loose DNA ends, and there will be a problem for the cells. Every time a cell divides, a telomere, it gets shorter. So it's essentially reflects the age of the cell, and eventually becomes so short that the cells cannot divide successfully and the cell dies. So it is very important in the context of defining the health of a cell, the age of the cell, and the inflammation relates to it, because when a cell is no longer healthy, the immune system is supposed to recognize it and get rid of it. So as we age, we have much more of these problems, and cells are less, they become more senescent, and the immune system reacts to it.
So actually, let's go right into senescent cells. I know that you focus on that too. They're called for laymen like me, zombie cells. And what's the connection between zombie cells, and what does the research tell you about how you can try to manage zombie cells to manage inflammation? And really, what are senescent cells? Just talk us through that, please.
Yeah. So as a cell age, become more senescent, they enter a state of senescence. They stop dividing the cells and they start producing inflammatory molecules. And these are known as senescent associated secretory phenotype, SASP. This is a medical term. And when with age, also the body produces more proteins that are damaged, or proteins that are no longer well done, and this also can trigger inflammation. And there is also production of reactive oxygen species, that because there is an aging of the mitochondria, and also this contributes to inflammation. So because of all these reasons, cells become zombie cells, senescent cells, whatever you would like to call them, but they're no longer functional. They become a source of inflammation.
Because they don't go away. They're still there.
They don't go
still
away.
Existing, but they're not contributing anything good.
Yeah.
Thus,
They
the
stop
zombies
replicating. They stop replicating, and they need to be eliminated. And unfortunately, the immune system, as we age, we discussed earlier, is no longer as efficient. So they tend to persist and sustain this inflammaging that we discussed. So there is a research effort in trying to target also these cells, not only the immune system, to see how we can rejuvenate the body, assuming that's possible. So this is what the zombie cells are.
Mm-hmm. So right now, is there anything we can do about zombie cells? Like, can we say, oh, I'm going to exercise more or do the Mediterranean diet? Does that impact zombie cells? Or once a zombie cell is a zombie cell, there's not much you can do about it at the moment? And that's where research is focused.
Well, I would say that everything that we discussed earlier about lifestyle, I think there is always a benefit.
Yeah.
But of course, the benefits, it's higher or greater when you start early, right?
Start earlier. That's right.
It's never too late.
No.
But we have to keep in mind that prevention is often more effective.
Mm-hmm.
So I will just try to make a change starting today, if possible.
Yes. Yes. I will nag everyone once again with love in my heart to start doing those planks, get out there for a speedy walk or run, so on and so forth.
Or simply a walk.
Or simply a walk, that's right.
Walk is important.
Just
and
moving.
Not everybody may have. Just moving.
I mean, dancing, vacuuming. I mean, just walking around your apartment.
Yes.
If you're on the phone, I even like to say, just walk. Don't sit and be on the phone. Mm-hmm. Walk on the phone. There are earbuds now, everyone.
Yeah.
We mentioned colchicine. And thank you for that very kind of deep dive into colchicine. Are there any other exciting things on the horizon that people should be kind of looking for, paying attention to, that I should be looking for in the medical journals that I get, and PubMed, and anything that, anti-inflammatory medications that we should be focusing on?
Well, we were talking about zombie cells, senescent cells, and there are a series of drugs that are being investigated, and they have reached different stages of drug development.
Yes.
And they are being tested or have been tested with negative results in some cases. But overall, the idea is that by using these drugs that are called senolytic, you could improve the ability of the body to get rid of these senescent cells. So these drugs are actually directly targeting zombie cells, senescent cells. And some studies are promising to the extent that from early stage preclinical models where you study these drugs in the lab, they have moved into early stage clinical trials to see whether these drugs are safe, whether they are effective at reducing the accumulation of these senescent cells. So the idea is that we want to maintain these senescent cells below a certain threshold that is not defined, but it's probably impossible to prevent it, but we can probably control this phenomenon to some extent so that there is a benefit for the overall health as we age.
Yeah, no, I'm looking forward to learning more about that in the months and years to come. I find it fascinating, and I will always keep an eye out. As I said, PubMed is my go-to.
Yeah, there is also another class of drugs that are being investigated that are those that targets, we talked earlier about SASP, that are all these inflammatory molecules that are produced by senescent cells. So in this case, the idea will be to have an alternative approach that alleviates the senescent-related inflammaging without eliminating the cells. So there is a lot going on in the field, and we are here to see what's happening in the near future.
And this is one question, and it's probably, I hope it's not a silly question, but I'm just curious about this. Inflammation in the body. You did mention early on that, of course, it's a good thing if you have an accident or an injury, let's say in your knee. I mean, it is inflamed, there is inflammation, and then your doctor may prescribe an anti-inflammatory like diclofenac, for example. Because that is an anti-inflammatory, does that have any impact on the overall inflammatory? Does it just specifically a drug classified like that? Or does that just specifically address that particular area? Do you know what I mean? Is that a possibility for overall inflammation or no?
Well, I will say that these are type of drugs that are prescribed for relatively short time.
Yes.
For specific reasons.
For a lot of reasons, or kidney issues potentially and all.
Yeah. So I think in the field, the idea is to find the sweet spot where you are able to control chronic inflammation without hampering the ability of the body to fight infections and cancer cells. So I would say that probably the best concept to have in mind is to restore normal immune response, if that makes sense, because you want to have a healthy immune system that is needed.
Yes.
We don't want to reduce the ability to fight infection in a patient, but we are not there yet. It's very difficult, but I see the field moving in the right direction.
Yeah, I hope so.
We have a lot of tools that were not available in the past, and I think that we will learn more and more about the biology and the pathophysiology of these conditions, and we'll be able to get to a point where we have better tools to reduce chronic inflammation.
Thank you. This was an incredible conversation. I loved taking this deep dive into inflammation, or inflammaging, as we also called it. And before we wind down this conversation, can I please just ask you, because we covered a great deal, what are your three most important takeaways that you really want the Age Better audience to remember today?
Well, I think that there are at least two main messages, right? We spoke about a lot of the science that is going on and where the field is going in trying to prevent or cure this problem of chronic inflammation, inflammaging. This is particularly important in an era where we live longer and we also want to live better.
Yes. We want to increase our health span, as we're saying.
Yes. So I will keep an eye on the future treatments that will be available, hopefully soon. But at the same time, we have to deal with what we can do. We have to deal with the problem right now, right? So we have tools that might not be the magical pill that solve all the problem, but we have tools that are available. And we spoke about the lifestyle changes that I believe are very important.
Yes.
This will be my takeaway, and try to eat better, move more, sleep better, and try to manage stress. The second point is that I think is very important, and it's about prevention and really being proactive about your health, and go see your primary care. Even if you feel well, why not to see your primary care once a year and get a blood test and see how things are for you, and if there is something that requires treatment, better to know sooner than later. Cardiovascular disease are particularly tricky because they are called the silent killer, because there is no symptom that you experience. So that's why it's extremely important to go and be very proactive about prevention. And all it takes is a regular visit, a very small amount of blood for lab work, and you're good to go.
Yeah.
So this will be my advice.
Thank you so much. I really appreciate that you took time out of your lab and everything else that you're doing to speak with us today about this very important topic. Thank you very much.
Thank you.
Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.